my first question is, you talk about getting doctors involved. I know from talking to them over the years that they are reluctant. There's a certain resistance and reluctance to having the contact with their patients on policy and political issues. How can we get them over that, and how can they talk to patients in a way that doesn't feel that they're using their power over the patients to unduly influence them?
Well, it's a great question. I think the best way to do that is just put out facts. In fact, let me tell you, who saw the President's speech to the joint session of Congress in the House and Senate a lot of you. Let me tell you this, Joe Wilson was the only one who spoke the truth in that speech. But the way to do it is, I think, what Dr. Rowe's practice is doing, and that's sending a letter out. But it's best to send it from you. I think it's best to send it from one individual. I've got a copy of Dr. Rowe's letter that he said I could share with y'all if you would like to see it and if you want to distribute it. But the best way to do that is just give some bullet point facts that you as a physician are not, if they put in place the public option, if we have a government take over health care, you're not going to be able to give patients the kind of care that you've trained to do. That there's going to be a government bureaucrat that's going to be mandating your practice. We've already seen that in Massachusetts and in Tennessee. So just put out the facts. It costs too much. It's going to cost jobs. The HR 3200, the Leuven Group said that 5.5 million people in America are going to lose their jobs under HR 3200. Another group has said that 114 million people are going to be forced off of their private health insurance onto the public option. We also already know what Joe Wilson was responding to is the President said illegal aliens will not get free health care. But that's a bald-faced lie. And he said that just in his frustration. In the Energy and Commerce Committee, one of the very first amendments to HR 3200 was put forth by Nathan Deal, who I've already mentioned. And what the amendment said is that, well, the bill actually does say illegal aliens do not qualify. But what Mr. Deal wanted to do is put in a verification, that required verification. The Democrats voted it down on a party line basis. In Georgia right now today, illegal aliens have Peach Care, IS CHIP, or State Child Health Insurance Program. They're already getting it, and they're getting Medicaid. Illegal aliens are. Both of those laws say that illegal aliens don't qualify. How do they get it? They just ask them. Are you a citizen? Are you here legally? See, we, or whatever they answer, and they say, well, okay, here's your free health care. They've got a vested interest. The bureaucrats have a vested interest to give it to them. We wanted to put verification in there. The Democrats blocked it. And in fact, the President just a week and a half ago said that we need to legalize all these people so that they can get free health care. So just put out the facts. We're going to have taxpayers funded abortions. We're going to have illegal aliens getting health care. We're going to have a government bureaucrat that's going to mandate how you practice medicine. We've got to stop it and just putting out the facts. I think is the best way to do that.
Do you like mailing a letter as opposed to doing it when they come into the office? You think
any way you can get in touch with them. I think mailing them a letter, emailing them, any other way that you can get in touch with anybody in your sphere of influence. Just contact folks.
We have 4 questions that I had recognized. We'll have time for 1, 2, 3, 4, and 5. So
now I'm staying the rest of the afternoon, so I'll be glad to speak with anyone.
Are you familiar with the Federal Tort Claims Act of 1996?
No.
Which provides free medical malpractice insurance to doctors who volunteer or work in free clinics.
Well, I am familiar with that.
Okay.
In fact, my bill just furthers that, too. I've got a bill that I'm going to be introducing within the next week or two that is totally privately based. It separates the doctor-patient relationship, contractual relationship, from the insurance, whether it's public or private insurance, so that the insurance company can't mandate anything to anybody. So, but yes, and mine does a whole lot of things, and that's one of the things that's
So in effect, if you work in a free clinic, you get free malpractice insurance from the federal government. And so a thought would be if doctors could donate their time, say 4 hours a week or 20 hours a month to take care of the poor, the government wouldn't have to pay for that care for the poor. That would save money. And what we're thinking is that why don't we if the government could then extend the malpractice insurance to his regular practice, in a sense it would be compensated for that care that he's providing for the poor, it would solve a multitude of problems. And
well, part of my bill is one that gives doctors a tax credit for delivering care to poor people who cannot afford their care. I've given away literally hundreds of thousands of dollars worth of my own services over 3.5 decades of practicing medicine. And I get nothing, as y'all get nothing, and I'm sure all of y'all have given your services away. I heard a lot of the folks during the Q&A period talk about that. Just recently I was describing my bill to Dr. Bob Coles, who's a urologist at Lake Oconee, and he's trying to establish just a tremendous medical center down there. And it's right in the middle of a number of counties that are extremely poor. And I was telling Dr. Coles that I want to give doctors tax credits for giving away free care. And he said, Paul, if you do that, I'll set up 2 days a week in my office, and I'll see nothing but people who do not have insurance during those 2 days. And that's what I'm trying to promote, is that. Exactly. Yes.
In order to do what Dr. Brown has just recommended, go to downsizedc.org. You can just write it down. It's all one word, downsizedc.org. And they will help you do that. Also, from the Washington Times newspaper, Capital Contacts, little book with the fax numbers, the Washington and Home Office numbers of the members of Congress, both sides, governors. And if you can't get the book for some reason right away, we have it online. 202-224-3121 is the switchboard, and you can remember the numbers. All you have to do is remember the last 4 digits, because for the Senate it's 202-224, for the House it's 202-225, and then the last 4 digits is your member. Call them up. I call them up every day. I talk to them, and I got a list of the blue dogs. So bite them in the ankles and don't let go.
There you go.
Thank you.
I want to point, Dr. McDowell's next. I wanted to point out someone. We have Dr. Miriam Martin's here from San Francisco, and she's actually registered to vote in New York. And I've talked to her, some of you about her. She got an unsolicited note from Representative Masson in New York, and she answered back to him with her comments about forcing doctors into unpaid work is slavery. He took her response without her permission, used it in his campaign literature, and launched an ad hominem attack on her about what a horrible doctor she is, and how just went off on her. So that's some of the stuff that we're up against.
Well, that comes right from Saul Alinsky's book, Rules for Radicals. Y'all familiar with that book? What they try to do is they try to marginalize all of us who are against it. They call anybody who is against Obamacare racist. They try to marginalize us. I've been called all sorts of bad names by the press, and that's fine. But what they try to do is they try to marginalize us and then isolate us and then destroy us, and that's part of the Rules for Radicals. By the way, if you're not familiar with that book, the dedication by Saul Alinsky was to the first radical, Lucifer.